ladies and gentlemen, boys and girls, I have someone here for you tonight who is an excellent speaker, who we've had multiple years in a row, and the reason why is because she does such a great job explaining all of the crazy new Medicare rules and guidelines and programs, and sometimes it's difficult to know exactly how to progress with stuff like that. And we have known Krista for 32 years. I've known her for 32 years. Dr. Lynn's known her longer than that. And so we're just very happy to introduce her to you. And she has put together an educational program that will help you know the difference between what your choices are, how it all works. She's open to questions. And I think you'll just be really happy that you came or that you're watching online. So thank you all for being here. Let's give her a little warm welcome, shall we?
Thank you. That was lovely. And thank you for having me back.
We're glad you're here.
So yeah, Brenda and Lynn and I have been friends for a really long time. And I am more than happy to be back tonight. My name is Krista Feeks-Dittman, and since last year, I own my own health insurance agency here in Lincoln, On Point Insurance Agency. I have been in the insurance industry for almost 8 years. So I have, while there are still new things that I'm learning, I have seen a lot and can probably field all of your questions tonight. So we're going to focus on really two different areas tonight. Different enrollment scenarios, because there are quite a few different life scenarios of people coming into Medicare. And the second is, once you're in Medicare, what are your choices? And you really have two. You have the supplement route or the Advantage route. And we're going to look at both and just give you some high-level things to think about, because each of you are going to have to prioritize what's important for you in your Medicare journey. So to start with, when do you enroll in Medicare? Uh-oh. There we go. So we have three typical election periods. The first is centered around your 65th birthday, because that's when most everybody becomes eligible for Medicare. So that's the 3 months before you turn 65, your 65th birthday month, and the 3 months after. That's called your IEP, initial election period. So if you're one of those folks, what you can do now, or even if you're years before turning 65, you can go to ssa.gov, and we're going to look at this in just a second, and you can sign up for your Social Security portal. It's kind of a nice tool to have. You can see then also what your benefits are going to be. So Social Security Administration runs the benefits and Medicare. So two different things they do, but all under one roof. And from there then, when you're getting ready to start your Medicare journey, you can go into your ssa.gov portal and apply for Medicare. You can do that at any point. There are a couple of little things we're going to talk about. And then once you are in the Medicare world, every year, you encounter the annual election period, AEP. I call this the Joe Namath season, because that's when he's on TV all the time. So in the fall, this is when you can change your Part D plans or your Medicare Advantage plan. So that's what happens in the fall every year. Other ways for people to start Medicare are through special enrollment periods. And typically this is retirement, or maybe moving. Like if you've already had Medicare and you move, there are different plans available in your new state, your new zip code. So these are our general enrollment reasons. So to start with, let's talk about turning 65 and receiving Social Security benefits. So if you have decided to turn on your benefits early, and you can do that as early as age 62, if you choose to. If you have had been taking your Social Security benefits at least 4 months before you turn 65, you're going to be automatically enrolled in Medicare. Boom. You don't have to do anything. Easy peasy. But now you don't have to take your Social Security benefits early. You can wait as long as you want, full retirement age, for those turning 65 after, who were born in 1960 or after, is 67. You max them out at age 70. But you can take your benefits at any time. And it doesn't have to go hand in hand with Medicare. But if you start them early, you will be automatically enrolled in Medicare.
Plus, it's a lot, if you do the 65, you don't get as much money as when you wait till 70.
Yeah. So with your Social Security benefits, you are correct. The longer you wait, the more you get. Yep. So that was our first scenario, turning 65. So I was looking for a check mark. I couldn't find one, so I've got blue lightning bolt up there. So we talked about that one. So the next scenario is you're turning 65 and you're not receiving your benefits. Or you're turning 65 and you need to decide, am I going to do it or am I going to stay on my employer coverage? So if you decide to start Medicare, this is where you go. This is just ssa.gov, nothing special here. What I have circled on the top right corner and in the middle where it says apply, both of these buttons take you to the same place. All roads lead to Rome here on the Social Security website. They're going to take you to, it's called Log Me In. And the government comes up with all kinds of really non-clever things. So Log Me In is where you get into your portal. So if it's a husband and wife, you each need to have a separate email. So it's email specific, and they do all that multi-factor authentication where you have to have your cell phone, all that. When you do this, my pro tip, sit down, close the door to your office, don't go answer your door, don't have cookies in the oven, because you need to do it. If you get timed out, they're gonna physically mail you a code to get back in. So when you're doing this process, just focus on it. I want to talk briefly here with this second situation. It's in green here. If you are thinking about starting Medicare or not because you're going to work, this might be the most important thing I say tonight. There's the rule of 20. If your employer, if you plan to keep working and your employer has fewer than 20 employees and you're on their plan, you have to start Medicare because Medicare will be primary. If your employer, if you have a large group, more than 20, then you have more choices. You can either start your A, defer your B, or defer both of them. This is really important. If your employer, if you're on your employer's plan and your employer has fewer than 20 employees, you absolutely have to start Medicare because Medicare is primary. What does that mean? Well, here's an example. I recently had a 70-year-old gal. She was on her husband's employer plan. He was a small group. There were 2 or 3 of them on the group. Everything was fine until she had to go in and start having some tests done. Well, once those bills started coming through, because Medicare was primary and she didn't have Medicare, she was on the hook for everything that Medicare was not going to cover. That was tough. So we got her started and I think everything is okay. But this is, like I said, this is probably the most important thing I'm going to say tonight. The size of your employer's plan makes a big difference when you're turning 65. So you can work or not work, but if your employer has fewer than 20 people, you need to start Medicare. All right. If you decide to work past 65, and by golly, I have helped 85-year-olds start Medicare because they have kept working. Bless their hearts. How many of you here tonight want to work till you're 85? Yeah, I see exactly 0 hands. I'm not raising mine either. So if you're going to work longer than 65, your path, you still have to go start at Social Security. You either call them or you log into your portal. But there are 2 other forms that you're going to need. The form CMS L564, the request for employment information. The reason you have to fill this one out, and you're going to take this form to your HR person or whoever's managing your plan. They have to fill it out and verify that you've had health insurance since the time you turn 65. If you've had multiple jobs, multiple employers since the time you've turned 65, you have to get one of these from each of your employers. I think the most I've ever had somebody had to fill out is 3. He happened to work into his 70s and had multiple employers, had to go back and get one of these from each of his employers to verify the time period that he was working there, that he had coverage. The second one is the CMS 40B. This form you use if you've already started your Part A. This is a short and sweet, but super important in the remarks section. Don't leave anything to chance here. Say, I want my Part B to start at what date it is. And it'll always be the first of the month, but these are the 2 forms then that you will need. And the 40B is online. You can do this, it's a fillable form online, and you can upload it into your portal. But this one, the L564, you actually have to take to your HR person. So again, these 2 forms, if you are delaying your Medicare journey, you'll need these.
Oh, can I ask a question?
Absolutely.
So if because we're both past 65 and haven't done any of this,
Yep.
is it date sensitive? Do you have to do it at any certain time?
It's your timeline.
Okay.
So the question was, if we're older than 65 and haven't started any of this, is this date specific? Your timeline.
Okay.
I would say just start early enough because you are dealing with a government agency currently. So this is July 2025. The agency have gone through a reduction in force, so there are fewer people. So give them more time, at least 2 months. You can submit an application like the day before you want it to start, but you're not going to get your card. You're going to be in kind of insurance limbo. So don't do that. That's going to give you heartburn. Just give them plenty of time.
So would you suggest, like, you said a couple of months, is that good enough? Should you start?
Couple months.
Okay.
Yeah. Couple months should do it. Okay, so we've just knocked out all 4 of these scenarios. Last one is if you're under 65 and on disability. So it's possible to start your Medicare journey before you're 65. But this is a whole different process and beyond the scope of what we're doing tonight. So what happens? Now you've started your A and B, so that's what you've applied for. Now what? So this is our roadmap that we're going to talk about tonight. So what do you add on to your A and B? I think there are people who don't add on anything, and that's a choice. I think that's the worst choice you can make. But here are your 2 choices. So on the left, original Medicare, which is your A and B, you add on a Medicare supplement and a drug plan. I call this the Highway 34 route because that was the first way that people could add on to their Medicare, just like Highway 34 was the first road that we had to get here and there. In Nebraska, we're in Nebraska. On the right is Medicare Advantage. That's your second option. Medicare Advantage is privatized Medicare. This is the I-80 route. Just so you have that visual, I-80, it's the newer road. It's the newer way that we get between A and B. And this is the newer way that people can add on to their Medicare. So this is our roadmap tonight, and we're going to keep coming back to this. Any thoughts, questions at this point before we forge ahead? Okay, so Medicare supplement, what does that mean? So usually you're going to see a chart with a whole bunch of letters. I'm narrowing it down for you. We're going to focus on Plan G, which is the Cadillac, and the Plan N, which is maybe the Kia. I don't know cars that well, so. But Plan G, if you can see here on the left in the chart, the top part is what Part A covers. Part B is in the next section, and then foreign travel is in the bottom. But G, you can see why it's the most popular, right? Because it has the most 100% coverage. Your Plan G is going to cover everything. The only thing it doesn't cover, and that's the little dash, here is the Part B deductible. So starting In 2020, we had Part B deductible that none of the plans cover. This year, the Part B deductible is $257. So if you're coming off of an employer plan with a $5,000 or $7,000 deductible, $257 seems pretty dreamy. Now that $257, that's the 2025 Part B deductible. That goes up or down every year. There's a lot of math behind it. But that is your only medical liability if you have a Plan G. So people who are completely risk averse will choose G all day, every day. Or people who have a lot of medical issues and are frequent flyers. Plan G is the way to go. We're going to talk about cost later, but you get it. The more services you get, the more you pay. So G is also your most expensive option at this point. Plan N is rising in popularity. It's good for us and for Nebraska. There are 3 differences, and you can see it in the yellow stripes, but I've highlighted them here with bullet points. First of all, I'm going to start at the bottom. Price. Plan N right now is $30 to $40 a month less expensive than a G. There are 2 things that N doesn't handle as completely as a G. The first is something called excess charges. Now, excess charges is this really small slice of the Medicare pie. It has to do with visiting providers who don't take Medicare. And what percentage of providers take Medicare? 98. About 98% of providers and facilities accept Medicare. So if you manage to go to that small slice, that 2% of people who don't take Medicare, they can charge you an extra 15% above the Medicare allowed charge, and that's called an excess charge. Plan G covers the excess charge, Plan N doesn't. And the third difference is, remember I said with Plan G, everything is covered beyond that $257 deductible. Plan N, you may have a $20 copay for some office visits, and you may have up to a $50 copay for ER visits where they don't check you in. So if you can handle a little bit of risk and you want to save $30 to $40 a month, N might be a good option for you. There's no wrong answer here. Everybody makes their individual choice. I've seen couples, husbands and wives, one has Plan G, one has N, or one has an Advantage plan. Not that they're 3 people in a marriage, but we're in Nebraska. We can't do that here.
So G does not have copay?
No copays. You only have the $257 deductible with the Plan G. Beyond, no copays. No. So usually January, February, your first visits in the year, that's when you're going to hit your deductible. And we're going to look at a couple comparative things at the end. Great question, though. Okay, so now we're going to talk about Part D. Part D for drugs. D for drugs. PDP is prescription drug plan. So prescriptions are a big part of people's lives on Medicare. And it's down here in our chart. It works the same way, whether you're on Highway 30 or I-80. It's like the wheels on your car. Whether you've got that Cadillac or you've got Kia, you need wheels. The rules are all the same here. So a prescription drug plan, you get one of these, helps cover the cost of your prescription drugs. You can change it every year during the Joe Namath season, annual enrollment period. And you need to have one unless you have VA coverage or another TRICARE or some other government program. Highlighted here is if you choose not to get a drug plan, Part D, prescription drug plan, and you decide to do it 5 years later, you're going to deal with a late enrollment penalty. Now, it's about 38 cents a month, but it's cumulative. So 10 months, just for easy math, you're going to have a $3.80 monthly penalty that you're going to pay forever as long as you have a drug plan. The longer you wait, the more you pay. So just sign up. The last thing here I want to talk about is IRMA. So IRMA affects your Medicare premiums. IRMA is an acronym for Income Related Monthly Adjustment Amount. You can Google this. This is all out on the internet. And it affects your Part D and your Part B premiums. So here I have the Part D chart. This is the same income chart. And there's a 2-year look back. So whatever year you're getting your coverage, you know, Social Security and IRS, they talk to each other. So when you sign up for Medicare, IRS is gonna report in for what your income was 2 years ago. So this is not your current income, it's 2 years ago. So Part D, you may pay more depending on which income bracket you hit. And also Part B. So I don't want to belabor the numbers here, but Part B and Part D, so B as in boy and D as in drugs, you may pay more based on your income from 2 years ago. So this rolls off. Like if you have 1 year or your last year working, you earned a lot of money, and then the next year your income drops because you're just using Social Security or your investments, you're gonna roll out of your IRMA charge. It's possible anyway. All right, we're gonna march on and talk about Medicare Advantage briefly. Any questions? Any thoughts?
It's a great program. Hasn't it only been around 60 years?
I think it has. It has only been around 60 years. And I think one of the presidents was actually the first person to enroll. I can't remember which one right off the top of my head.
Wow.
Yeah, and his vice president was the second person to enroll. So when Medicare started, right, you could add on a supplement and a Part D plan. That's our Highway 34 route. Sometime in the 80s, Medicare Advantage came on the scene. So there was a ton of fraud, waste, and abuse. We hear those words a lot these days. It was also a thing in the 80s with Medicare. And so Medicare Advantage came on the scene. What it is a private insurance company managing your Medicare benefits. So it's called Part C. We just can't have one name for things, right? Medicare Advantage, it's called Part C. It combines your A and your B and usually includes your D. So here's a little visual. Has your hospital A, your medical B, and your D for your drug coverage. One plan, one card. For those of you coming off of an employer plan, this feels very similar. Very, very similar. But how are these things different? Well, I know these words are kind of maybe hard to see, but premiums. Medicare Advantage have low, maybe no premiums. That makes them more attractive to a lot of folks. Medicare Advantage plans do have networks, either PPO, where you go in or out of network, or HMO, where you strictly have to see providers in that network. Whereas there are no networks when you have a Medicare supplement. Anybody from New Hampshire to Oregon and in between, anybody who takes Medicare is going to accept your supplement. Deductibles. We've been talking about that Part B deductible of $257 that you have with your Medicare supplement. Advantage plans usually don't have deductibles. You just go right into some kind of cost sharing, whether that's a copay or co-insurance amount. And a lot of the copays, like for your primary care physician, a lot of those plans have $0 copays. Specialist visits are $40 with a lot of plans, but you may have to get a referral to go to that specialist, just depending on your plan. With an Advantage plan, there are also yearly out-of-pocket limits. So kind of like your employer plan, there's a maximum that you'll pay. This year, the range is somewhere between $3,500 and $4,500 for most plans. Changing plans, you can change them every year. Again, Joe Namath season, October 15th to December 7th. Important dates in your lives when you're on a Medicare journey. Availability. Here in the Lincoln, Omaha metro area, you've got lots of choices. Lots of choices. Not so many choices out in greater Nebraska. The further west you go, the fewer choices you have. Hospital copays. So this is a big deal. So if you have a supplement, whether it's a G or an N, you're never going to see hospital bill. So if you're a frequent flyer in the hospital because you have some medical condition, diabetes or whatever it is, having a supplement, you're never going to have to worry about a hospital bill. With a Medicare Advantage plan, you're going to have a daily copay, $350, maybe $400 a day for the first 3 to 5 days, just depending on the plan. Skilled care. So Part A covers the first 20 days. And if you have a supplement, it's going to pick up days 21 to 100. You're not going to have to worry about how many days you spend in skilled care. It's all going to be covered. With an Advantage plan, days 1 to 20 are still covered by Medicare, but your plan may regulate how many days you get. So based on all of the data that they crunch, they may say, Joe, you are a 68-year-old non-smoking male. You've just had a hip replacement. But you still need 3 days in skilled nursing or 8 days, whatever it is. And you may have to appeal that decision to get more. Maybe your individual situation requires more care. So that's going to roll into one of the next points I'm going to make. We skip down just a little bit. You may have to appeal denials, or you have to wait for pre-authorizations. Now, these are some of the things that are being addressed. I mean, Medicare, it's a big program. It's a little bit like having a house. You have a house, there's always something to fix. So the changes that are always coming around, it's not personal. They're just trying to make something better for us. So appealing denials and waits for pre-authorizations have been big problems with Medicare Advantage plans, but they're working on it. But the thing that make Medicare Advantage plans so attractive, and the sales tactic used by a lot of agents, especially the ones that are calling you. How many of you who are getting a lot of Medicare calls? Yeah, I heard a couple of groan over here. They're wanting to switch you to an Advantage plan. And they lure you in with, hey, you can get free dental. You can get free vision. You get a gym membership. We'll give you money every quarter to get things like at a Walgreens or CVS, over-the-counter items that'll make your life better, which those are all great benefits. It may be a good decision for you and it may not be. So what does the money look like? Well, here we go. So I wish I could have made this bolder, but we have all the different parts of Medicare down the middle. Is there a laser on this thing?
No, sorry.
All right. So in the middle, we have all the different parts of Medicare. So from the top down, Part A, that's zero. You don't pay for Part A. If you've worked your 40 quarters and paid into the system, Part A is zero. Part B, this changes every year. This year in 2025, your Part B premium is $185, unless of course you have IRMAA, I-R-M-A-A, Income Related Monthly Adjustment. And you would have to pay that whether you're on the Highway 34 route or the I-80. It's kind of like a fuel additive. If you're going to use a fuel additive, you're going to have that either way. Now, a supplement. So here on your left, I put in $130. This is roughly what a 65-year-old female starting Medicare in Lancaster County, Nebraska will pay. In fact, I did one today for $130.67. Plan N, you can do that for $85 to $110. And Plan G, even though the coverage is the same, prices can go all the way up to $160, just depending on the company you choose.
Per month.
Per month. Yep, these are monthly charges that we're talking about. Thank you for clarifying that. Yep. Finally, we're coming down. I'm going to stick over here on the left-hand side. Part D, the most popular little drug plan. It actually has a $0 premium this year. About 75% of all Medicare eligibles across the country are on it. So we're looking at about $315 a month if you're gonna have a Medicare supplement. So that's here in Lancaster County, Nebraska. And if you don't have, or if you're just on generics, you don't have any heart meds or any, you're not diabetic, this is probably what you're gonna be looking at. Over here on the right, Medicare Advantage, we only have, you still pay the $185, that's your Part B premium. That's the gas in your car, right? You have to pay that either way. But you only have one premium. And here I have a $0 premium written in here. The range here in Nebraska this year is 0 to 32. There's actually a $97 one. But you can see here your monthly cost is $185. So in the yellow box here, I've taken the difference times 12. So if you have an Advantage plan, you're saving $1,560 every year. So that's just in your premium savings. So at this point, people are like, well, just sign me up for an Advantage plan. Well, okay, but let's look at a couple scenarios. So I always forget how small things are going to be on the screen, so I apologize for that. But the gist here that you can get, even without seeing the numbers, there are three scenarios. The top is a healthy year, the middle is an average year, and the bottom is a catastrophic year, so health-wise. So the idea of a healthy year, maybe you have a specialist visit or two, go to your primary care visit, nothing major, you're just doing some maintenance stuff. You have little co-pays, $180 of co-pays. That's even less than your $257 Part B deductible. So in a healthy year, you're gonna save a lot of money being on an Advantage plan. And you get all those extras, that dental, that vision, over-the-counter allowance. In an average year, so in this middle scenario, imagine you're working in the yard, or maybe you slipped on the ice, but you've broken your wrist. And there are a lot of little bones in your wrist, you're gonna have a pin put in. So there's a surgery procedure. Well, surgery procedure with an Advantage plan is maybe $350 to $400. Not awful. I just had a new hip put in and they charged my insurance company like $30,000. So, you know, $400, that seems like a real bargain. In this scenario, though, in an average year, by the time you do your physical therapy, have your extra x-rays, all that extra stuff, the total here is $1,285. So we're getting really close to what your premium savings number was. It was just over $1,500. If you have a Plan G, just as a comparison, you paid your $257 deductible and you're done. No worries. Now in a catastrophic year. So this is when everything goes wrong. Maybe this is a cancer diagnosis, hospitalization. So if you do chemo and you're paying 20%, it's expensive, right? So you're definitely gonna reach your max out of pocket. And the red down here, the max out of pocket, $3,500 to $4,500 for the year. So if you have a catastrophic year, there's at least a ceiling of what you're gonna pay. Over on the left, if you have a supplement, you pay your first $257 and you're done. I'm gonna go back just real quick. See this $130 number for the supplement? That's a 65-year-old female. The company that you choose for your Medicare supplement, they're gonna give you a birthday gift every year and they're gonna charge you more. Or I guess they're gonna ask you for a birthday gift. That's gonna continue to go up every year that you get older. And I just helped a gal move from a Medicare supplement. She's about 80. She's paying $400 a month. So if you do that quick math, if you're paying $400 a month, what you're paying here is now more than your $4,500 that your Advantage plan is. So she was in Greater Nebraska. She didn't have an Advantage option, but she was able to switch her Medicare supplement at least. But you can see where at some point it goes up so high that probably by age 75, you're going to definitely want to be thinking about Advantage. So there's nothing wrong with Advantage. It's just a different route, right? It's your I-80 route versus the Highway 34 route. You're going to get there, but you're going to have a different experience.
I have a question.
Yes, ma'am.
So, like when you're talking about skilled nursing and the copay per day on skilled nursing, does that still fall in the out-of-pocket limit?
It will on an Advantage plan. Yep.
Okay.
So day 21. Now every plan regulates that a little bit differently, but usually this year it's $206 a day for days 21 to 100. That's the Medicare charge.
But if you have a supplemental, it would be, it's not covered by supplemental?
It is. You don't see
then
any
you
bills.
You'd have a $0 bill. With an Advantage plan, you'd still have your copay per day until you're max out of pocket.
Right.
Okay.
And the Advantage plan might be telling you, hey, you have 5 more days that you're going to be able to stay
You
here.
gotta get better quick.
Yeah. Well, since the first 20 days are covered by Part A in Medicare, it's amazing how many people get better in 19 days anyway.
Oh, nice.
Yeah. So, what choice is right for you? That's going to depend on your individual needs, your medical needs, your financial setup, your risk tolerance. There are a lot of factors, so there's no wrong answer here. The worst answer is not to choose, but
I got a question for
yes. Yeah.
you. On a supplement, you're taking a lot of drugs, and some of the drugs cost out of sight. So your supplemental costs more because of those.
No. So drugs. So let's go back here to the wheels on our car. The wheels on our car is your prescription drug plan, your Part D plan. That covers your prescriptions that you're going to get at Hy-Vee, at Walgreens. Now, if you have like Entresto or Xarelto,
Or an Eliquis.
and Eliquis, that's a big one, yep. And you can't find it from our friends in the north at a Canadian pharmacy, and you're using your plan for it, you're going to want to make sure that your plan covers it.
Yeah,
And
that's my problem now.
yeah. So your Part D coverage, you want to check it every year. This year is the first year that there's a maximum that you pay with your drugs. There's a maximum of $2,000 if your plan covers it. You're really in a sticky situation though if you're on a drug plan and you get a new med in the middle of the year and it's not covered. That's sticky. That's really sticky.
Yeah.
So let's talk afterwards, and I might have a couple tips for you.
I might get your card and just talk to you down the road.
Okay, that's why I brought them.
That a girl.
So great questions, though. What else? What else can I cover for you?
You said something about cost per county. Is that different in every county in Nebraska then?
So, right, so premiums are set by zip codes and by rating areas. So just depending on the company, usually they're, like in Nebraska, they're anywhere between 2 and 5 rating areas. Usually because people in the Lincoln, Omaha metro area make more, we pay a little bit more. Further west you go, the premiums are a little bit lower. So they do some fancy math based on income. Yeah. Yep. So
Oh, I'm sorry.
yep.
So if you've had cancer, if you've had a heart or anything before, and then you have to go on these plans, is that a big factor?
So you are going to, if you're leaving an employer plan and you've had insurance, that loss of coverage is, and the start of your Part B, your Part B start date, that's your golden ticket to start whatever Medicare you want. And it's going to give you a rate not based on your health, bet on your age. So if you're a 68-year-old female leaving your job, you're going to get this rate. If you're a 78-year-old female, you're going to get a rate here. Of course, tobacco use factors into that. Yeah.
And doesn't Part D then change things as well with that question she just asked?
So all Part D, okay. I'm gonna
Because
answer-
that's drugs.
Yeah, so I'm going to answer it two ways.
Okay.
Part D, this year there are 14 plans. Those same 14 plans are available to everyone. You choose the plan that fits your needs based on what drugs you're taking, what pharmacy you want to go to. So there's software, you put in the name of your meds and your pharmacy, and then it'll give you a price estimate, and it'll rate those plans based on your annual cost. So you have available to you all 14 plans. You choose which one is best for you, but the premium isn't higher because you have a condition, but you may have to choose a more expensive plan.
Because of the drug that's in that plan.
Yeah, exactly.
Well, if you get your drug from Canada, can you count that? I mean, you don't have to count it?
So that doesn't count towards your $2,000 maximum, but likely, I mean, I haven't looked recently, but I don't know what the tariffs have done to drug prices out of Canada, but last year it was definitely an option. It was a viable option.
Yeah, it's half of what I would have got it here.
Yeah, it just depends on the prescription, or if you can do a generic as well. Yeah. Great questions.
Are chiropractic visits covered?
Right,
by
so
Medicare?
let's talk about chiropractic since we are at Turning Point Chiropractic. So Medicare in general, while they cover chiropractic, they are not as big a fan as we are of chiropractic. So they will cover chiropractic visits if you've been injured and you're getting better. The maintenance stuff that chiropractors believe in and contribute to our health and well-being, that's not covered. So it's going to depend on how your chiropractor codes your visit. So, Medicare Advantage, it's going to depend on your plan. A lot of plans will give you a certain amount of visits, maybe 15 visits, maybe 20. Brenda mentioned there was one plan this year that gave unlimited visits. That's new this year. I think they're trying something out. And you may have a $10 to $25 copay for a visit. So if chiropractic is really important to you, then that's the thing that you talk to your agent about. Make sure your chiropractor accepts the plan, and then see how those visits are covered. Thank you, that's perfect. Yeah. So, but Medicare in general is less of a fan of chiropractic. Maybe
Well,
that'll
I'm just
change.
asking because my mother lives in another county and she's getting her chiropractic care covered.
It might depend on her plan.
Possible.
Oh,
Yeah.
you have a chiropractic question?
Yeah, and it might be how the chiropractor is coding her visits.
Well, that's
also.
possible
No, it
too.
is coding.
It's coding, it has to be.
So I was sharing that Medicare in general isn't as huge a fan as we are of chiropractic, and that they tend to cover the things if you've been injured and getting better,
Yes.
and not the maintenance.
Right.
Do you have anything to add there?
Yeah, it's sure. It's called active treatment, and so if Medicare only covers active treatment, like there's a new injury and you're getting after treating it, and once you get to a stable place where probably it's just going to maintain at that level, then it's a maintenance care, and Medicare doesn't cover maintenance, only active treatment. They only cover adjustments, active treatment adjustments. They don't cover exams, x-rays, traction exercises, in general. There is a new Advantage plan that has started covering exams and one set of x-rays per year and maintenance chiropractic visits. The only time I've ever seen maintenance adjustments covered for a Medicare patient before. So it's brand new this year.
Well, my mom's not on a maintenance or an Advantage plan, so I don't know how she's getting her chiropractic care covered.
She's getting reimbursed.
Yeah,
She's
through
paying
Medicare.
for it
She
first,
pays for it, and then
and
the
they send her a
doctor
check.
sends it in, and they send her, Medicare sends her a check.
I've not heard of that, so that's interesting. I'd like to
And
learn
it's a
more about that.
chiropractor in Nebraska.
And she doesn't have an Advantage plan. Does she have a cost plan?
I don't know what she has, but
No.
she has a supplement and original Medicare. She's 88 years old.
Well, good for her.
I mean, could it be possible that her chiropractor participates in some kind of other program or plan or
It's
something?
covered by Medicare. She gets a check from Medicare every month that she goes, and she's seen every 3 weeks.
Wow.
Yeah, they maybe they're saying that it's active treatment.
I don't know.
Could be, but
So I said that,
Just FYI.
so early on I said that there's still stuff I'm learning about Medicare. Here we go. I'll be looking into that because that's really interesting. What else? Well, this is where you can find me online at insuranceonpoint.com. Our local phone number is 402-625-6578. So not Turning Point Chiropractic, but insuranceonpoint.com.
Nice.
Yeah.
Let's give Krista a round of applause here.
Okay, thank you for having me.